Hi, today in San Antonio we had a very interesting session on contralateral prophylactic mastectomy, which is the removal of a healthy breast when there's cancer in the other breast. And I'm here with Dr. Partridge. She was a speaker on that panel. And Dr. Partridge, there were some really interesting conversations that happened. Can you tell us what the data showed in particular for young women, and what kind of your message would be to young women who are thinking about or newly diagnosed and trying to figure out what surgery they should choose?
So when young women are diagnosed with breast cancer, they need to decide how to best treat the cancer in the breast where it is. And an issue that often comes up is, should they do anything about the other breasts? Because by virtue of having developed one breast cancer, they're at risk for another cancer occurring in the other breast. It's a really, really difficult decision because ordinarily you wouldn't take a breast off that was healthy. On the flip side, for many young women, they will be at increased risk of new problems in the other breast over time, just by virtue of aging, and especially if they have a deleterious, meaning a risk-associated change in their genes, such as a BRCA1 or 2 mutation, that predispose them to get the first breast cancer in the beginning. And so when women are in that situation, then we often counsel them, yes, if you're comfortable having bilateral mastectomy, that makes sense. But what we're seeing population-wide in the U.S., but particularly in young women, is that more and more of them are taking the healthy breast off, even when A, they don't have a high risk of having a new primary in the other breast, which is the only thing that taking the other breast off will help, and B, when they can have breast preservation in the breast where they need to have treatment, meaning a lumpectomy followed by radiation, and yet they're choosing to have both breasts fully off with reconstruction, that can lead to a lot of risks medically, as well as cosmetically, as well as obvious loss of a sexual organ, the breast, when they don't have to. So that's not to say that anybody's making a wrong or bad choice. What it's meant to say is something's going on. The disease itself hasn't changed. And again, most women don't have a mutation, so something's going on in our population and our culture that is driving more women to say, I want them off. And some of that may be good, and some of that may be associated with women not really understanding what it means to have them off. So that's what we talked about in our session, and that's what we're exploring in our research as well, how to help women to make the best decisions for themselves, but really understand the pros and cons of those decisions.
So I would say a message for young women then is just to talk very carefully with your doctor and your oncologist and get as much information as you can to make your decision.
Absolutely. Get the information. And what I would say, even more so than getting information, is tease out with your loved ones, with your providers, what's driving your decision, and make sure you have the facts, because we are seeing that some women, what's driving their decision is the desire to live longer, and the fact is that taking the other breast off is not likely to actually lead to that. And there are many things that can help women live longer, and unfortunately, most young women will be long-term survivors, but if taking the other side off isn't going to promote that, it's a lot to go through.
Great. Well, thank you very much for your interesting presentation today and for taking the time to speak with us. Thank you.